अस्सलाम वालेकुम नाजरीन, बिस्मिल्लाहिर्रहमानिर्रहीम। और मैं हूं आपका होस्ट मतीन शहजाद और आज हम हाजिर हैं कोविड-19 लर्निंग सेल के एक और वेबिनार के साथ। नाज़रीन, जैसे कि आप जानते हैं कि आज दुनिया भर में वर्ल्ड अर्थ डे भी मनाया जा रहा है और अल्लाह ताला ने ये पूरा अर्ज़ हमें हवा, मट्टी और पानी से मिलके बनाया और इसको हमें तोहफ़तन पेश किया, हमें दिया। अगर हम इस वक्त देखें तो पूरी दुनिया जो है वो एक पेंडेमिक सिचुएशन में घिरी हुई है और कोरोना वायरस की वजह से उनको एक बहुत ज़्यादा प्रॉब्लम्स बार बार फेस करनी पड़ी हैं और इन्फेक्शन जो पूरी दुनिया में फैल चुका है। हेल्थ के प्रोफेशनल्स जो गाइडलाइंस दे रहे हैं या WHO की गाइडलाइन है वो ये है कि हाथ को हमने बार बार धोना है। मैं इस वर्ल्ड अर्थ डे की मुनासबत से एक आपको पैगाम देना चाहूँगा कि जहाँ पर हमने अपना बचाव करना है कोरोना वायरस के साथ और हाथों को बार बार साफ भी रखना और धोना है, इसी दौरान जो है पानी का जो ज़या है वो भी बहुत ज़्यादा हो सकता है। तो इस दौरान प्लीज़ जहाँ पे आप अपने हाथ धो रहे हो, पानी जो है उसका एहतियात से इस्तेमाल कीजिए, बिकॉज जितने भी रिसोर्सेज हैं वो बहुत ज़्यादा स्केर्स हैं और अगर ये रिसोर्सेज कम होते जाएंगे तो हमारे कुरायर्स को बहुत ज़्यादा मसाइल का शिकार होगा और ये जो हमारे प्रॉब्लम्स हैं वो बढ़ते जाएंगे। जैसा कि मैंने शुरू में जिक्र किया कि कोविड-19 ने कुरायर्स के ऊपर पूरी लाइफ को चेंज कर दिया और हम लोगों को एक मैसेज दिया जा रहा है कि स्टे होम टू स्टे सेफ एंड लेकिन कुछ लोगों के लिए हम लोग ये मैसेज बिल्कुल अप्लाई नहीं करते और वो हैं हेल्थ केयर प्रोफेशनल्स। जो हेल्थ केयर प्रोफेशनल्स हैं डेफिनेटली जिसमें डॉक्टर्स हैं, जिसमें उनके पैरामेडिक्स हैं, स्टाफ है, वो दिन रात 24 घंटे अपने मरीजों की खिदमत में मसरूफ़ हैं और कोशिश कर रहे हैं कि अपने मरीजों को जितना जल्दी इस बीमारी से निकाल के सेहतमंद इंसानों की तरफ या सेहतमंद माशरे की तरफ लेकर जाएं, वो ज़रूर कोशिश कर रहे हैं। इस सिलसिले में अगर आप देखें तो डॉक्टर्स और पैरामेडिक्स जो है वो पेशेंट्स को बहुत करीब से देखते हैं और उनको बार बार चेक करने के लिए पेशेंट के बहुत करीब जाना पड़ता है, जिसकी वजह से बेड साइड के ऊपर जो कोरोना के प्रॉब्लम्स आ सकते हैं और वो डॉक्टर्स और जो पैरामेडिक्स हैं जो कि पेशेंट को वो ठीक करें तो वो खुद भी इन्फेक्ट हो सकते हैं। एक बहुत ही इंपॉर्टेंट टॉपिक जिसको आज हम लोग लेकर आए हैं कि डॉक्टर्स और पैरामेडिक्स और उनके जो स्टाफ हैं वो कैसे अपने आप को इससे प्रिवेंट कर सकते हैं। आज हमारे साथ दो पैनलिस्ट हैं। एक पैनलिस्ट जो है वो हमारे साथ ऑस्ट्रेलिया से हैं और दूसरी पैनलिस्ट है हमारे साथ पाकिस्तान से। अगर मैं सेशन को देखें तो आज हम लोग सेशन जो है वो दो हिस्सों में रखेंगे। पहला सेशन जो है वो वी आर टेकिंग इट लाइव फ्रॉम द ऑस्ट्रेलिया और दूसरा सेशन हम पाकिस्तान से मिस रोशन से ले रहे होंगे। और आपके जो भी क्वेश्चंस होंगे प्लीज़ आप अपने क्वेश्चंस को टाइप कीजिए, टेक्स्ट कीजिए और उसके बाद हम लोग सेशन के आखिर में क्वेश्चन एंड आंसर लेंगे। तो हम चलते हैं अपने प्रोग्राम के अगले हिस्से की तरफ। तो आज की हमारी फर्स्ट जो पैनलिस्ट हैं शी इज़ फ्रॉम ऑस्ट्रेलिया, मिस सबा अकबर। मिस सबा अकबर ने अपनी जो इनिशियल एजुकेशन है दैट इज मास्टर्स इन हेल्थ साइंसेज एंड हेल्थ इंफॉर्मेटिक्स US से अपनी तालीम हासिल की है और इस वक्त जो मिस सबा अकबर PhD कैंडिडेट हैं फॉर हेल्थ इंफॉर्मेटिक्स के अंदर और हेल्थ इनोवेशन के अंदर फ्रॉम ऑस्ट्रेलिया। So let's welcome Ms. Saba Akbar on this webinar. So I would like to give this session to you. So please go ahead for your presentation.
Thank you, Mateen साहब। Okay, so जैसे मतीन साहब ने बताया कि आज हम बात कर रहे होंगे कि कुछ जो प्रोफेशनल्स है they have to still work even though the world is in pandemic situation and everybody is asked to stay at home. लेकिन फिर भी जो है health care professionals because we are all essential workers so we're still working. हेल्थ केयर प्रोफेशनल्स जो ऑल द हॉस्पिटल्स क्लिनिक्स में जाके काम कर रहे हैं, इसके अलावा भी लोग हैं दुनिया भर में, फॉर एग्जांपल रिसर्चर्स और IT कंपनी पीपल या मैन्युफैक्चरर जो प्रोडक्ट्स बनाते हैं, जो हमारे लिए PPEs तैयार करते हैं, वो तमाम लोग भी इस वक्त काम में लगे हुए हैं। सो इट्स नॉट अ ब्रेक फॉर एनीवन। कोविड ने एक्चुअली सबको और ज्यादा बिजी कर दिया है। एंड अगले कुछ मिनट के लिए जो मैं बात करने वाली हूँ दैट इज मेनली अबाउट कि हम दुनिया भर में इस पेंडेमिक को, इस क्राइसिस को IT की मदद से, हेल्थ इंफॉर्मेशन टेक्नोलॉजी की मदद से कैसे मैनेज कर रहे हैं। सो मूविंग ऑन, व्हाट आई टॉक अबाउट इज मेनली व्हाट इज हेल्थ IT, किसको बोलते हैं, क्या चीजें हेल्थ IT में शामिल होती है, And then why do we need it the most now? इस pandemic के दौरान why should we care about technology? Like इस वक्त तो हमारे लिए शायद virus ज़्यादा important है, but then why should we actually talk about this? And then how's, like I said, world managing this pandemic? And then I'll be breaking this into 3 parts. स्क्रीनिंग एंड प्रिवेंशन, कि हम टेक्नोलॉजी कैसे यूज कर रहे हैं मरीजों को स्क्रीन करने के लिए, एंड देन वायरस के ट्रांसमिशन को बचाने के लिए, प्रिवेंट करने के लिए. एंड देन इफ समबडी कम्स पॉजिटिव विद कोविड, तो डिजीज का मैनेजमेंट टेक्नोलॉजी के थ्रू कैसे हो रहा है. एंड देन हाउ आर कंट्रीज यूजिंग टेक्नोलॉजी टू फॉर सर्वेलेंस, बड़ी सतह पे, वसी सतह पे लोगों को कैसे देखा जा रहा है कि किस तरह से ट्रेंड्स हैं, और वो टेक्नोलॉजी कैसे हेल्प करेगा. So first things first, health IT. So in easy language, health IT is anything that is related to health. It could be health services, health information, and then how is that linked with IT, information technology? And then when we bring both of them together, we say it's a health IT. So कोई भी वो चीज जो information technology को use कर रही है और health से related है, when you combine them together, it's called health IT. Now, why do we need it the most now? If you look at the picture on the right, that's our beloved coronavirus. That's like the most popular thing in the world at this point. And as of this morning, there were more than 2.5 million people infected with it. Now, ये जरूरी है कि हम इन numbers को देखें, because this, unless we are sensitive about the severity of the disease, we won't be able to appreciate technology का importance इस वक्त खास तौर पर. Now, we are all going through this unprecedented situation. It's not like कि दुनिया में पहले pandemics नहीं हुए. There have been pandemics before. Why is it unprecedented? Is because आज की दुनिया अलग है, कदरें अलग है. There is a lot of advancement. It has become, there are no, like boundaries are now only on maps. People are more connected. Everything is fast paced. So उन सारी चीजों को देखते हुए, it's very important to understand कि आज का pandemic पिछले pandemic से कदरे मुख्तलिफ है. And then of course हमारे पास जितना human resource है, जितना material resource है, वो सब finite है, वो सब limited है. And like I said, we are living in a fast-paced environment, and we need to get ahead of this virus. That is the only way to solve this issue at this point. Is कि क्योंकि virus तो फैल रहा है, but we have to get ahead of it, and that is where technology is actually helping us. Now, especially for COVID. So, अब मैं बात करूंगी special tools, softwares, techniques जो कि use हो रहे हैं coronavirus को prevent करने में, screen करने में, disease manage करने में, and then surveillance में. Number 1, especially for screening and prevention, symptom checkers. These are very basic, usually mobile apps. पाकिस्तान में भी है, बाहर दूसरे मुल्कों में भी है, बहुत सारी कंपनीज ने अपनी निकाली हुई हैं. So what these apps do is they allow you to check your symptoms. So they ask you series of questions about mainly your symptoms. So for example, बुखार है या नहीं, गला खराब है या नहीं, सांस लेने में तकलीफ है या नहीं, and then travel किया है या नहीं. उन सारे सवालात के बाद those apps tell you कि whether or not you should seek treatment or stay at home and like don't worry about it. Now, some of the symptom checkers, some of those apps are independent or standalone, which is like random companies, random app developers have come up with these apps, whereas some are actually integrated in appointment booking system. So there are several hospitals in the world कि जहाँ पर if you are going in to book an appointment online, they'll first ask you to go through the symptom checkers so that they know at the beginning कि आपके symptoms, चाहे आप किसी भी मर्ज के लिए appointment ले रहे हो, but they'll ask you this thing first. And then people have now created virtual triages. So triage is actually a facility which is usually found in emergency rooms within hospitals. And then whenever a patient goes to an emergency room, triage per healthcare professionals are there to receive you, to look at your symptoms, ask you basic questions. And then they tell you कि कहाँ, किस level का treatment, किस level की services इस मरीज को देनी है. Now, hospitals have created virtual triages, which means even if you don't want to go, so of course, like we said, कि इस time पर social distancing is the key, which means जितना आप घर में रहेंगे उतना बेहतर है. So अगर आपको कोई और मर्ज भी है, like if you don't feel like, even if it's not COVID, but you need to go to hospital, पेट में दर्द है, सर में दर्द है, so instead of going to hospitals physically, use online triage. That will actually help reduce exposure और इस तरह से इसका ट्रांसफर रुक जाएगा. इसके बाद जो इम्पोर्टेंट चीज आती है स्क्रीनिंग में, दैट इज रैपिड टेस्टिंग. नाउ वी नो कि टेस्ट कोविड का बहुत जरूरी है और हमें बहुत सारी टेस्टिंग किट्स चाहिए. इसलिए टेक्नोलॉजी इज हेल्पिंग अस मेक टेस्टिंग फास्ट एंड एफिशिएंट, because we know that time and money are of utmost value here. We're running out of time, we don't have enough money, but we need to test more people. So companies are now coming up with portable testing kits, which are like smaller kits so that it can be used anywhere, not necessarily inside a lab. And more interestingly, countries around the world have introduced drive-through testing clinics. So it's like जब आप McDonald's जाते हैं खाना लेने and then you go through the driveway. So you can get, without even getting out of your car, you can get the meal, right? It's in the same way, drive-through testing clinics allow you to stay in your car and get your test done. Okay, and then contactless arrangements. So no more paper pens, sharing pens, no more using the clipboards in hospitals. We're going more towards contactless arrangements. So hospitals are now encouraging filling your, for example, initial registration forms from your home or on your own device. So BYOD is bring your own device. So hospitals encourage you to bring your own mobile or any other electronic device to use it while you are inside hospital, so that there is less sharing and less contact. And then now genomic screening has also become a huge part in this whole coronavirus screening process, because researchers have found that jitna severity so अगर एक इंसान है जिसको कोविड पॉजिटिव आया, उसके symptoms की severity might be very different from another person who may be showing symptoms. So ये जो severity है, that has some connection with how our genomic structure is. And that's why people are doing genomic screening to predict whether or not किसी का severity कितनी होगी. And then that is how you can plan the resources. Okay. Now, telemedicine. We have, at least I have had last 2 of my doctor's appointments online. So telemedicine is there, everybody is using it, and that is because we need to maintain medical distancing. Even in Pakistan, there are several companies that were already doing teleconsultations, but of course now they have to do more of it. Hospitals are also now doing teleconsultations. So unless you necessarily have to go to hospital, don't go. Stay at home, use these technological resources. So what telemedicine does is it allows patients to communicate with doctors, audio, video tool. जैसे हम और आप कर रहे हैं इस वक्त, इसी तरह patient और doctor communicate करते हैं. This again reduces exposure. Of course, आप जा नहीं रहे, आप मिल नहीं रहे डॉक्टर से, so आपका exposure कम हो रहा है. हॉस्पिटल नहीं आ रहे, सबसे बड़ी बात है कि आपको हॉस्पिटल नहीं आना पड़ रहा, क्लिनिक नहीं जाना पड़ रहा, वहीं से आपका exposure rate कम हो रहा है. बट इसके challenges हैं. अब क्योंकि इतना ज़्यादा इसकी requirement हो गई है, तो we need this to expand rapidly. There are certain technological, hardware, software considerations, plus not all electronic health records or not all hospital information systems have their own teleconsultation software. So अक्सर क्या होता है कि Zoom use हो रहा है या Skype use हो रहा है, which are standalone or independent systems. And then hospitals को usually there are some legal and compliance requirement to document things. इसलिए you would see अगर आप कभी hospital जाते हैं या अगर आप खुद doctor है या nurses हैं, you know how important it is to document everything. But when you're doing a teleconsultation, of course, you need to customize your documents accordingly. And then costing and billing. Now, because the doctor isn't going anywhere, patient isn't traveling, how do you charge people? Aapka costing, and then if you have to get another new system, how does that affect your costing? So of course, all of these are challenges that are now here. Okay, that was all prevention and screening. Now disease management. Now, if there is a patient who has been diagnosed with coronavirus, now remember, not all patients need hospitalization. Most of the patients, especially who are young, who don't have their immune system compromised, they can stay at home isolate themselves, and manage their symptoms at home. So not everybody needs to be hospitalized. So we've got technology to help us with remote monitoring. Now, when we say कि हर किसी को hospital की ज़रूरत नहीं होती, उसका हरगिज़ ये मतलब नहीं है कि उन लोगों को monitoring की ज़रूरत नहीं है, right? So even if they are at home, we need to monitor them. So there are two kinds of monitoring systems that are available right now. On the right top, this is a centralized monitoring tool. It's kind of a patch. It's called single-use biosensor patch that a person who has been diagnosed with COVID can wear for 5 days. And then this device will continuously monitor that person's vital signs and ECG. And then there's this company that manufactured it is looking at the data. सारा वो जो जितना भी हार्ट रेट और पल्स रेट और सब चीजें कलेक्ट हो रही है इंफॉर्मेशन, वो एक सेंट्रल क्लाउड बेस्ड सिस्टम पे मॉनिटर किया जा रहा है। एंड देन अगर कोई मसला होता है किसी मरीज के साथ तो वो वहां से डायरेक्टली अप्रोच करते हैं। दैट्स कॉल्ड सेंट्रलाइज्ड मॉनिटरिंग। Now there are certain tools that help us with individual monitoring. So बहुत सारे ममालिक में जब वो लोगों को क्वारंटीन कर रहे हैं या सेल्फ आइसोलेशन में रख रहे हैं तो they give them thermometers या oximeters to keep it with themselves, and then they can take their own temperature and pulse oximetry, and then they can monitor themselves. So if they feel like, oh, nahi, mera temperature zyada ho raha hai, so they have to report it. So that's called individualized monitoring. Again, both of them requires technology. Identification and isolation. Now, if a patient, say for example, if a patient is in hospital, already admitted for a certain reason, now if that patient has gotten the virus and has been diagnosed as COVID positive, technology can help create alerts or notification. The reason is if you do not identify patient in time, and if you do not let people around that patient know that this patient is COVID positive, we are risking other people, right? अगर आप बताएंगे नहीं तो बाकी जो लोग इर्द गिर्द हैं उनको नहीं पता चलेगा, and then there's a chance of transmission. इसलिए there are systems in place that would send alert and notification. And then when that patient is moved to isolation, there are options available for virtual care, which means हर दफे डॉक्टर को या नर्सेस को या पैरामेडिकल स्टाफ को पेशेंट का एक्सपोजर करने की जरूरत नहीं है. They don't need to go inside the room. There are technology available that would help you do the care, monitor patient from outside. So you can do video communications inside the patient room. You don't have to send in patient's family inside the room. They can video call from outside. And then there are external display boards. So vent setting, agar patient ventilator pe hai, to uski monitoring, cardiac monitor attached hai. So there are systems that will get all that reading outside of it. So room ke bahar monitor ho rahe ho. And now for all this to work precisely, effectively, we need better electronic health records. Now is the time when everyone is realizing the need for a higher level of interconnectedness. Because अगर आप monitor बाहर लगा देते हैं, लेकिन अगर आपका EHR ही develop नहीं है इतना, तो of course you'll face challenges. Not like you can't do anything, but there will be challenges. And so people are now moving towards smart decision support systems. These include smart nodes. So like systems will have coronavirus related smart notes that guide clinicians' documentation. Because remember we said documentation can be a challenge, right? So now we have smart notes that would help clinician, that would dictate clinician about documentation, some pre-filled documents, some hints for documentation, some prompts there, and similarly for orders. Now, if you look at this, and this is just an example of how a smart system looks like. So this gives you a drop-down menu of, for example, in this one, we have a list of symptoms. Now this does two things. One, the doctor doesn't have to type in everything. It's a drop-down menu. The doctor can just select and go ahead. Two, there is less chances of missing out anything. So you're getting complete documentation and also correct documentation. And this happens because health IT. Okay, now from administrative point of view, we've got executive dashboards. What dashboard does it? You know how you have dashboards in your cars, right? What do? They tell you what's happening inside of your car. So they tell you, okay, speed kitni ja rahi hai, fuel kitna hai. They tell you main indicators. Similarly, executive dashboards let decision makers, let managers or like leaders of your hospital or clinics know that what is the status. So bed trackers are included in it. So like कितने मरीज हैं, कितने मरीज COVID positive है, and then कितने recovery पर है, कौन कहाँ है, कितने beds available है, ventilators कहाँ है, कहाँ नहीं है. Now this all helps in resource management later on. And finally, surveillance. Now this part is very interesting because you all know that close contacts of COVID patients are at high risk. But how do you know who was at close contact, right? So if I am going for, say, grocery shopping, or अगर मैं उस supermarket में हूँ, and then 2 days later, somebody is diagnosed from COVID, उस person से I haven't met personally, but he might have been in the same supermarket that I was 2 days back, so I would be part of close contact. But how do I know? How would anyone know? So again, technology, and people are now using tracing apps. What they do is they use आपके mobile का GPS data and cellular signals, and they connect you. So if you look at the picture here, you see there are like circles. These indicate mobile signals. So when we have our phones handy with us, they're sending out signals. ठीक है, हर वक्त, constantly, unless you make some like really advanced setting, but they're doing it. And then if you have those tracing apps, which some countries are making it mandatory to have, तो अगर आपके पास वो apps है, तो वो app से authorities would know कि आप इस वक्त कहाँ थे. And then if somebody is diagnosed positive, they can go back and look at the cellular data and they can see कि अच्छा इस मरीज के पिछले से एक हफ्ते के दौरान या 14 days के दौरान इतने लोगों के साथ close contact हुआ, and then they would send information to people who were in close contacts. Those are called tracing apps. Like everything else in technology, there are challenges. Data privacy. If I have that app on my phone, that would mean मैं जहाँ जाऊँगी, authorities would know. So there are questions about privacy. And not all GPS and cellular signal data is 100% correct. और जिन जगहों पर जिन ममालिक में ये अप्लाई करा गया है, वहाँ पे there have been dozens of false positive cases कि क्योंकि mobile data has been able to capture people who are even further away than we want to say, जिसकी वजह से there have been a lot of false positive errors. Now when false positives happen, in one way it's good कि लोगों को पता चलता है and they can get a preventive test. But like I said, we don't have so much resources, right? Our resources are limited. So we don't want everybody to get their test done. Otherwise, we'll run out of all the test kits. So false positives is a challenge. And then enforcing restrictions. Government ने बता दिया कि घर में रहना है. There are certain rules. WHO ने बता दिया कि घर में रहना. But then how do we make sure that everybody is actually staying at home? Or how do we make sure that people, especially who have been asked to isolate themselves, COVID positive है या close contact है, जिनको कहा गया है कि खास तौर पर आपने quarantine में रहना है, self isolation में रहना है, how do you make sure कि वो रहते हैं? So then again, governments are using technology to enforce those restrictions. So in some countries in Asia, what they do is they give Bluetooth enabled wristbands to patients, and they're being monitored. So उनका activity. So if they leave the room, the authorities would know. Similarly, governments are using CCTV cameras or drones just to make sure everybody is following the restrictions correctly. Okay, and very important, data analytics. Pandemic hai, बहुत सारे patients affected hai. And like I said in my first few slides, that we need to get ahead of virus. How do we get ahead of virus? We learn more about virus, and we do it by looking at the data that we have. So कितने मरीज कहाँ पे किस तरह से, and then researchers and clinicians around the world are using and applying artificial intelligence, machine learning, natural language processing, all those techniques to track कि virus का spread किस तरह से, and then to contain. This also helps us understand the virus ka features, virus ka spread pattern. All this happens because we have access to data and we analyze it. Now, tech giants, for example, Google and Facebook and even Amazon, they are also helping authorities, they're helping WHO understand this. They are developing models to find out the spread. Okay. My final message after all of this talk on how technology is helping us, please remember one size does not fit all. So what one country is doing may not be applicable to another country, especially when it comes to technology. There have been times when, and there have been like real case studies when one country had this particular EHR, another country adopted the same EHR, didn't do much, replicated it, and it was a failure. And this happens especially with technology. So if you are in a decision making position, or if you are in a healthcare setup who is using a technology, or if you are on your own using any app or any technology, just remember that what happens in one country should not be replicated in another. We need to customize it. Now, how do we do it? We ask ourselves all these questions. How many more cases will we see? Look at the data, look at the trends, and focus. When will it peak? कैसा नंबर जा रहा है? फॉर एग्जाम्पल मैं इस वक्त ऑस्ट्रेलिया में हूँ एंड वी नो के हमारे नंबर्स कम हो रहे हैं, काफी कम हो गए हैं. बट अगेन द अथॉरिटीज आर प्रिडिक्टिंग के देयर विल बी अ सेकंड वेव. सो प्रिडिक्शंस हैं कि पीक होगा एक दोबारा. एंड देन इफ यू आर इन अ हॉस्पिटल सेटअप, विल यू रन आउट ऑफ बेड्स? विल देयर बी इनफ आईसीयू बेड्स? वेंटिलेटर्स होंगे नहीं होंगे? आपके पास रिसोर्सेज कितने हैं? पीपीएस कितना है? ग्लव्स खत्म हो रहे हैं, मास्क खत्म हो रहे हैं, हैजमेट सूट्स खत्म हो रहे हैं. एंड देन अगर खत्म हो रहे हैं तो हु इज योर सप्लायर, कहाँ से ले रहे हैं? एंड देन व्हेन डू यू स्टार्ट बैकिंग अप थिंग्स? और जब चीजें शुरू होंगी तो हाउ डू यू गो बैक फर्स्ट? सो ऑल दीज क्वेश्चंस हेल्प यू थिंक कि आपके लिए कौन सी टेक्नोलॉजी इज suitable. My message for the day is need of the time is collaborations and partnerships. Clinicians, informaticians, tech companies, we all need to come together and make solutions for our own region. So we need more of collaborations and partnerships going on, especially at this time. Yep, this was it. Thank you so much. These are my contact address. Please feel free to reach out if you have any questions. And with that, I'll pass it on to Mateen Saab.
Thank you very much, Miss Saba. It was such a wonderful session, and I really was so much amazed the way you have presented it. और actually मिस जो आपने टेक्नोलॉजी का जो इसमें हम लोगों को एक एस्पेक्ट दिखाया है, मेरे ख्याल में आज से पहले आज तक हम लोगों ने इस हेल्थ केयर सिस्टम में ऐसे जितना ज़्यादा इम्प्लीमेंट होता हुआ नहीं देखा. Said is Aga Khan, definitely it's one of the best hospital in Pakistan. तो definitely Aga Khan में ये technologies use हो रही हैं. Suppose शिफा इंटरनेशनल है या even शौकत खानम. But अगर आप mass level पे देखें तो maybe अभी भी we need to improve a lot about it. मेरे पास काफी ज्यादा questions हैं, अपने भी दिमाग में से कुछ निकल रहे हैं, तो I'll do ask you questions, but after the second presentation.
Sure.
And we'll move to the second presentation. Let me introduce our second panelist. Her name, she is one of the renowned Pakistani healthcare professional. Her name is Miss Roshan Hadwani. She is currently working as head of department and manager infection control in NICVD Hospital, Karachi. Previously, she has done her master's in infection control from UK and master's in administrative sciences from Pakistan. She is the alumni of Aga Khan University Hospital, Karachi, and she is also a lifetime member of Infectious Disease Society of Pakistan. And she is also a member of Infectious Control Nursing Association. So let's welcome Ms. Roshan Hadwani on this webinar. And Ms. Assalamu alaikum and welcome to the show.
Walaikum assalam.
Miss, thank you very much for joining in. Or I hope so कि आपने Miss Saba की भी talk सुनी, or hopefully you can conduct a presentation. So Miss, over to you, अपनी presentation, if you can switch it on and you're ready for this session.
Okay, can you hear me?
Yes, you are.
Okay, the topic which I'll be going through is bedside measures for COVID-19 prevention. I'll be talking as what we are doing, what hospitals or healthcare settings should do to prevent the COVID-19 and any sort of other infections. All right. So first, let me talk about the COVID background, which Saba has very well covered, and then we'll be talking about the epidemiology, clinical issues, how it is diagnosed, prevention is what is the prevention treatment, and I'll be focusing more on standard precautions and care bundles, as most of the patients who are getting admitted to the hospitals, they end up in ICU and where they need the care bundles. Okay, and all
मिस
the
आपकी
information.
if you don't mind, मैम आपकी जो presentation वो नजर नहीं आ रही, so if you can
नहीं आ रही
screen
है.
share it. Yes, you can, if you can share the screen.
Can't you? Acha, I thought it's there.
No, it's okay.
Technology.
Oh yes, obviously we are still learning with each
Yeah.
passing day.
Okay. Okay, so what I said that I'll be covering bedside measures for COVID prevention, and the talk, most of the things Saba has covered very well, like the background, the epidemiology, the issues people are facing, how it is diagnosed, and all. Most of the things she has covered, but I'll try to like. Share few of the things which she might not have added, and then my talk will be mostly on the standard precautions and care bundles, as most of the patients जो भी हमारे पास healthcare settings में आ रहे हैं, they are ending up in ICU settings, right? So my most of the recommendation would be of standard precautions and care bundles. And the informations which I'll be sharing is from CDC and WHO. Okay, so let's see. We are saying COVID. So what is it? COVID is a disease. Okay, and the form, if we take how it is, COVID is breakdown. So corona, CO is corona, and then VI is virus, and D is for disease. All right. So the virus name is SARS-CoV-2, and then it is taken as severe acute respiratory syndrome coronavirus. All right. Okay, how it is transmitted? It is a zoonotic thing, and it is transmitted from animal to human. Corona is most commonly spread, everyone knows, is through sneezing, coughing, close contact with the personnel who are positive for COVID, and then when we are in contact with the organism from one patient to another. Okay, the problem. Okay, the problem is that this is the third outbreak in 2 decades. Like in 20 years, we are facing the third outbreak. First was SARS in 2003 and 4, then MERS-CoV in 2012, and then now it's, presently we are tackling this COVID-19. Okay, if we look at the COVID-19, MERS-CoV, and SARS, so the thing which you can see, it's two were from China, one is from Arabian city. This time, the animal host is not very clear. They are saying it could be a bat, but we don't know at this moment. It has the, human to human transmission is there, nosocomial infection is there, which we are, we all have to be very alert. Risk to healthcare worker is very high. I'll be sharing few of these studies and you'll be amazed that, oh, like the risk is so much high. And then countries like, this data is of March, but now you can see, which Sabah has also shared the numbers, like we have gone to 2.5 million. Recoveries are there, but deaths are also there. Okay, if we take the RO, that is the basic reproduction of the disease, you can see that with the COVID, one infected patient can, infect 2.5 people. All right. And if you compare the infection rate with the death, you can see like respiratory failures are coming in 36, like 53% of the patients, respiratory and cardiac issues are coming in 33 patients, myocardial damage is coming in 7 patients, and there are few instances where we still don't know the cause of the death in the COVID positive patients. Okay, death rate, if we confirm with the other cases, you can see like the people who are more than 60, the risk is very high. Like if you are 60 or 70, the risk, infection risk is 3.4%. But if it's 80 plus, the risk is 14%. And from out of 14%, 22%, almost 22% of the patients are dying. If you see the female and ratio of female and male are more prone to this disease than if you compare with the females. And those who are positive, who are having positive comorbids of cardiovascular diseases, diabetic, respiratory disease, hypertension, and cancer, they are more prone to the disease. All right. If we compare COVID, MERS, and SARS, you can see the COVID, the year is, yes, more than 60 comorbids. If like 40% or more percent we are giving, if you are comorbids are there. So 40% chance is there that you can acquire this COVID-19. ARDS and pneumonia is the main feature which we are seeing. And then ultimately they go into, shock and multi-organ failure. Most of the patients, they are, they are requiring invasive mechanical ventilation, vasopressors pressors are required, and then renal replacement therapy is also required. And then you can see the mortality is very high. Looking at this slide, it calls for the, nurses training here. Like the nurses who are working in intensive care units, are they aware of how to take care of these patients? Like are they enough knowledgeable as how to take care of ventilated patient? How, like, are they aware of the inotropic support, the reactions, the side effects, the dosage and all? And do they know the renal replacement therapy? I'll share, in one of the hospital, they had the renal replacement thing, but they were not aware as how to, disinfect the renal replacement CRRT machine, and they were not even having the manual. So this we need to check, like whenever we are getting these kind of instruments, you need to have, manual, need to have policy and procedures. So nurses and doctors, they need to be very, like, they need to be experts in their field. If they are experts, then only they should work, otherwise we will lose our patients. Okay, clinical issues, naturally it is transmitted via a respiratory droplet, and incubation period is like 6 to 12. But today only I got a call from one of my colleague, and he said, मैं Friday को जो है एक नमाज के लिए जा रहा था, and I was called, I was requested कि भाई ये पेशेंट पॉजिटिव है, इसको शिफ्ट कर दो. तो मैंने उसको शिफ्ट कर दिया, एंड 2 दिन के बाद जो है मेरा गला खराब हुआ, एंड देन आई गॉट फीवर within 2 days. So I said, were you able to follow all the precautions? He said, nahi na, namaz ke liye jana tha, so I couldn't, put on all the like gown and PPEs and all. And now Like he said, I'm in quarantine for almost 14 days. And then after 14 days, I was asked for the, PCR, and again it is positive. So I said, okay, then you should again go for the, quarantine for more 14 days. So this is the situation, that incubation period is 2 to 14, we are saying, but it can go up to many other days also. Okay, the suspected case, I think Sabah has discussed it very well, but here I would like to address the curve severity score, like patients who are, if they are having fever and cough, we are asked them to, stay home, take supportive treatment, maintain distancing and all. But if the patients, if they are 60 plus, and if they are having curve sign, like confusion thing is there, from orient new like score is less than 8, BUN is more than 20, respiratory rate is high, like more than 30, blood pressure systolic and diastolic, is less than 90 and 60. And if they are of age of 65, but if they are not having any epidemiological link, but still we need to, we need to take care of those patients, and keep a question mark that they might come up as a positive. And we have seen a patient, he came, he said, I don't have any of such, a link, I didn't go anywhere, I had no contact with anyone. We admitted the patient, we kept in on, we took it as a suspected case, and then after fifth day he came positive. So you need to be very careful. Okay, confirmed cases, we know that the laboratory test should be confirmed, but close contacts, those who are coming in close contact with the positive patients, they need to be, sent home, and they need to be quarantined for at least 14 days. And then after, they get their test done, and if it's negative, then they should come to the, like they can join the jobs or wherever they want to. Confirmatory tests like PCR, the testing is required, and it can be done, like if you see, like PCR testing is not recommended to do in laboratory setting, because so many people are there. So there should be a setup where a negative pressure room should be developed, and there the sampling should be done. In these patients who are coming with the pneumonia, we are seeing that they have, the leukopenia is, in them, the leukopenia is 70%, LDH, LFTs, and ferritin level is very much elevated. Chest X-ray, chest is the thing. Consolidations, you'll see ARDS pictures, and you can see. And then, the thing, like the findings, they get picked up until 10 day, and then most of the time it gets resolved by 14 days. Diagnosis, yes, you do with the RT-PCR, and then the sampling is done, for upper respiratory samples you can done, you can take lower respiratory sampling also, like sputum you can take, endotracheal aspirates you can take, and then bronchial lavage can also be done for this test. Repeated sampling with initial test, if you are getting negative, it doesn't mean that patient don't have the, is negative. If the epidemiological link is there, and if the patient has comorbid, and the ages of more than 60 plus, then the alert should be there. And then the up till now it was said that the organism or PCR or virus is in respiratory thing, but now in stool and blood also it is isolated. So like overall, when we are taking care of the patients, we need to be very cautious with our PPEs and all. And many a times what happens when we go to the patients, we don't care for the other things. We think that, oh, patient is COVID positive, so we have to just take care of the respiratory thing. But here it's alarming that we have to be very cautious when we are taking care of the other like stool and blood and other things also. Okay, I was just going through a few articles, and there I found that 167 patients came to one of the facility between Jan and Feb, and from them 5 patients, they were negative with RT-PCR, but CT was positive. And after 2 to 8 days, the PCR was positive. The other were 55 patients were those who came up with positive PCR and positive CT chest. But so if patients are coming with negative PCR, but the findings are there, you need to be very careful. Okay. So what actually you need to do? We need to follow the standard precautions. Like you need to, as the new novice nurses or new entries are coming in your hospital setting, you need to develop courses. You need to take sessions for them, like orientation should be there, and infection control should be a major part of the orientation. So you need to, educate. In our setting, we have developed flyers, as you can see on the screen, and it is pasted on almost all the wards and soft boards. So people are, they know what they have to do. And then washing hands is like all the time we are behind them, that wash hands. And now I think they know why we were saying to wash hands. Okay, so if it's visibly dirty, you need to wash with soap and water, and if it's not visibly dirty, you can use alcohol. Okay, here I would like to share a video.
Morning, Barbara. Are you okay? To change that dressing of yours that you had on for about 2 or 3 days. Yeah. Is that okay with you? Yeah. Did you sleep well? What are you reading today? Oh, so you're cooking, yeah?
This will show that at how many times we forget to do the hand washing, and how infection is transmitted from one patient to another.
Morning, Barbara. Are you okay? To change that dressing of yours that you had on for about 2 or 3 days. Yeah. Is that okay with you? Yeah. Did you sleep well? What are you reading today? Oh, so you're cooking, yeah?
from this video. Like many a times, you know, if something is not there, we are not voicing it out. If PPs are not there, or alcohol hand rubs is not there, or soap is not there, you need to voice out to your managers and to your supervisors. And then we have a practice that with the dirty hands, we are moving from one patient task to another, and with dirty hands we are handling the curtains and all, and computers and all. So you need to be very careful to break the chain of infection. Excuse me. Then you need to practice the hand hygiene, respiratory hygiene, social distancing is very necessary, especially if you have cough and fever. Excuse me. Okay. And then, since you are in the healthcare setting, you have so much itching and all, all the time your hands are on your eyes, mouth, and nose. So you need to be very much careful. Mask and personal protective is very important. Like if you are sick, this is what we are educating our attendants, patient, and staff, that if you are sick, you need to wear, mask. If you are caring for patients at home or at hospital, you need to have your mask. And if you are, in healthcare setting, it is mandatory in this season that you need to put on the mask. Okay. If you are not well, stay home. And if you have, like difficulty in breathing and all, then you must come to the hospital. Otherwise, आप घर पे बैठे and take supportive treatment. Prevention in healthcare, how can we prevent infection in healthcare setting? Like हम ये बोलते हैं patients को कि they should stay home. If they want to, if they have any complaint, they can call us. Instead of visiting the hospital, they can come to they can call the facility. And if they are not well, and if they have breathing issues and all, that is the only time they should come to the hospital. Here we have developed few more flyers and all for our healthcare workers, and I think every facility they should like पाकिस्तान की setting में बहुत सारे hospitals ये काम कर रहे हैं, and तो कर ही रहे होंगे, but they should develop these kind of flyers which is self-explanatory and all. And they should be like healthcare workers should be educated to go through these flyers, and थोड़े थोड़े अरसे में ये flyers जो है change करते रहना चाहिए, क्योंकि एक ही चीज को देख के many a times वो उसको भूल जाते हैं या वो उसको इग्नोर करते हैं. तो अगर कोई न्यू चीज होगी तो they will go and read it. Okay. If patients are coming to the facility and they are positive, we say that the healthcare workers should, wear masks. And if patients are positive, requiring, any procedure like aerosol generating procedure, then the healthcare workers should wear N95 mask, and these patients should be kept in negative isolation rooms. And the patient should be given a surgical mask all the time. Okay, when I'm talking about the negative pressure room, it's something like this. Like when you enter from the corridor, you should have an empty room where you wear the PPE and all, and then you enter in the room, and or you get the fresh air from fresh air, and then all the air goes to the bathroom or to the room from where it is exhausted out. It is not circulated to the other units or other part of the hospital. And then you can, there are a few HEPA filters which can be taken by the hospital that also play the same room. And if resource poor countries can create their own negative isolation rooms, like for instance, a bed is there at one place, and from back of the bed, like at the door side, you keep the fan, so and the window should be kept open so that all the air go out in the environment instead of circulating in the room. So this can be we can make these kind of rooms also. Exposure to healthcare worker, as I was saying that in healthcare setting we have seen many patients, many staff who are acquiring infections, and patients also. Okay, and in one study it says that infections the patients, resident and visitors are getting was because of suboptimal use of infection control, procedures. So we need to be very, very careful for this. Okay, in another study, it was seen that 41% of the patients, got transmitted, got this infection. Out of them, 12% were the patient who got admitted for some other reason, and then they got positive. And the 29 patients were those healthcare workers who were working and they got positive and they had to get admitted to the hospital. Okay, in one study, they saw that 3.8% of the staff got admitted with the positive COVID picture, and then out of 3.8, 14.8 were in severely, they were very critical, and then we had 5 deaths from that. It was from China. Okay, when we talk about the mask, there are so many kind of masks. Some says use cloth mask or a carbon mask or this mask or sponge mask. But what we are recommending that in healthcare worker, you need to wear surgical mask. If patient is positive, give them the surgical mask. And if you are doing any aerosol generating procedures or patient is intubated and you are there, then you need to wear the N95 mask. Okay. And then what are the strategies? Like as Saba has also said that they are also facing shortage of PPEs. Okay, so we shouldn't like the urgent procedure should only be done in the hospital. All the non-urgent cases can be cancelled. N95 mask can be used if patient is positive. N95 mask can be used uh, uh, per shift for like one staff can use per shift. And then if patient is a suspected case, in that situation, N95 mask can be used by the healthcare workers, and to दो तीन suspected patients जो भी हैं उनको वो उस mask से take care कर सकती हैं. And then the surgical mask they can wear for whole day. All right, and in one day they can change like 2 masks they can change, but not more than that. And that mask can be used in between patients. Okay, these are another flyer which we developed in our setting, which says that when we have to, use what PPE. So this is very for them. They feel very relaxed when these informations are accessible to them. Okay, now when should we discontinue the precaution? We have to discontinue precautions when patients get, healthcare worker or anyone who are positive and you feel that they can be discharged. So they can be discharged, but they need to be in the quarantine, and before they join the hospital or they can go to their work, two samples should be negative. RT-PCR should be negative. Two samples should be negative, and it should be 24 hours apart. Okay, now very quickly I'll go through the chain of infection. Like everyone, the healthcare worker is aware that we have infectious agent in the environment. Reservoirs are we, people, equipment, and water and all. Portal of exit is our secretions and all, droplets, skin and all. Transmission is via your direct contact, your aerosols, your ingestion and all. And then portal of entry to the patients or to the ones are through broken skin. That is why we are said that if you have any break or anything, bandaged it, and then you should come. Mucous membrane, like when you are doing suctioning and all, and if you are not wearing mask and all, then there is a chance that you can get the infection. And then the susceptible hosts are those who are neonates, the immunity is low, cardiopulmonary patients, and they are the ones. Okay, now how can we break the chain? There are so many, First of all, rapid identification of the organism should be there. Anyone, if they come to know that patient is infected, they should, the same time they should notify the infection control or whoever is taking care, whoever is taking care of the infection thing. It is notified so that they can place the precautions, or they can place the patient in a separate room or designated room. And then reservoirs are always equipment people. So if we are doing hand hygiene and all, if we are properly doing disinfection and all, water is chlorinated, then we are breaking the chain from infectious agent to reservoir. And same goes, if we are wearing mask, and the transmission is like food hygiene is there. If you are getting needle stick injury and all, that is correctly taken care of. Airflow is good. Water temperature is good. And how it is entry, how it get enter to the patients or individual is when you are, doing invasive devices or any procedure, you need to be very much cautious, and you need to follow the asepsis technique. And then appropriate care is done. Okay, another video is there, but I don't know if you'll allow me. But let me take you to this form. This is when we came to know that this is COVID is in the air. We developed few standard operating procedures and all, so that everyone know that how they'll take care of patient. These are some of the another flyer as how to don and doff the PPEs, because here patients, the healthcare workers are very much confused. Like when you don, you need to wear the gown first. Like first you need to do hand hygiene, you wear the gown, then if you are tying at the back, so your hands are contaminated, try to again do the hand hygiene. And then after that, you need to wear the mask and all, eye shield, and then gloves is at the end. What we see, that people wear glove first, then they move everywhere to collect the equipment, and then they wear other PPE. So by that time they are coming to the patient, the gloves are contaminated. And when the doffing is there, during doffing, you first remove the gloves by pinching the gloves from here, and then you take off the gloves. do hand hygiene, then you need to take off the gown, then do hand hygiene, respirator, and then other things, and then eye shield, mask, and all, and then you need to again do the hand hygiene. So this is must. Okay, so these are the flyers also. Disinfection is very, very important. Many a times people don't know how to do the disinfection. The first thing which is necessary is to decontaminate the equipment, like with soap and water, then take off all the, excess water if you are going for disinfection, then put in a, in a disinfectant, then rinse it up with clean water or RO water, and then let the things dry, and then do a packing and keep for the next use. So everything should be written on the disinfectant, that for how long it will then when will it expire and all. Okay, environmental hygiene is again very, very important. You can see the cross. These are all the places where organism resides. So if you see a room very, clean, it doesn't mean it has, no organism. So routine cleaning is very important. When patient gets discharged in general setting, the soap and water should be used to clean the mattress, everything, all the high touch areas and all. And if patient is positive for any infection, then terminal cleaning is necessary, where hypochlorite solution is used, and then you wait for some time so that contact time is there. Curtain is also changed if patients are infected. There are many bundles which we need to take care of. Actually, what bundle is a structured way of improving the process of care and patient outcome, and these are very small straightforward sets of evidence based practices, and they are at times three or four or five. Okay, so I'll be quickly go through this. Like, if you want to stop the CLABSI, that is central line associated bloodstream infection, when you are putting the line, there are few standards. When you are taking care of the lines, you need to do hand hygiene. If you are using the stoppers and all, you need to clean it with alcohol and all. So there are so many things you need to, do. And then if your dressing is there, you don't have to, change the dressing every now and then. If a transparent dressing is there, you can keep it for 7 days. If gauze is there, it gets damp and all. So you can change it when it is dirty or after 48 hours. So these are the items which you'll be needing. Then if patient is on ventilator, you need to follow the ventilator prevention care bundle. There are so many things like when you are putting the when you are intubating, before intubation, the laryngeal blade need to be cleaned with alcohol swab. Recently we have seen, and I was told that there is an outbreak of acinetobacter in one of the ICU, and then we did environmental culture, and in environmental culture, you won't believe, the laryngeal blades were having acinetobacters. Like, can you imagine acinetobacters on laryngeal blade, and the box was having, acinetobacter. So through those box and laryngeal blade, patient were getting acinetobacter. So you need to be very, very careful. Okay, so you need to check that HME filters are there, the circuit is changed. If it is for long term, the circuit is changed after 7 days. It should be labeled. If patients are intubated on ventilator, aseptic technique should be done, bed should be elevated, sedative and interruption and assessment should be checked for readiness to pay for patient extubation, PUD, DVT prophylaxis should be there. And then oral hygiene is very necessary. And it is said that if you use use for chlorhexidine, the infection cuts to half. तो ये बहुत सारी चीज़ें ज़रूरी है. अगर PEEP is more than 8, you should use inline suctioning. So there are so many things. And then what our infection control nurses do, they visit all the critical care area patients from one patient to another, and they have active system. They check that what are the, WBCs, if patient is febrile, if what kind of secretions are there, and if secretions are positive or getting, like thick, then they are sending the culture, they get the report, and then isolate if something is getting positive and all. And then sessions and all is all the time we are doing it. Then. And then COTI, there are other standards for catheter associated infection care bundle. That also you need to, we can have another slot जहाँ पे हम ये सारी चीजें डिस्कस कर सकते हैं कि कैसे क्या केयर बंडल है और किस तरह करना है. And then all these should be, आपके पास documentation should be there. We have developed bundle care checklist जिसमें the nurses every day they are, ticking the things, and that reminds them कि हाँ मैंने ये कर लिया, ये कर लिया, ये कर लिया. And then we have goal sheet also, where nurse and doctor checks that if patients actually need the CVP. If they don't need CVP, they discuss and then they remove. Cardiac implants, many a times the temporary pacemaker is put in and it is left for, a week or 10 days because nobody cared for it. So dialysis catheter is there. If these are required, then it should be there. If it is not required, then it should be taken off. Nutrition should be checked. That is patient, many a times patient is kept NPO. So that check. Prophylaxis, as I said, DVT prophylaxis, GI things are there. So when it is on the paper and staff is taking it up, they get to know that, okay, I forgot this, so I have to do this. So these are, and then you can see the outcome when you do all these things. You can see the outcome, like the COTI rate was like 19%, and now it dropped to 0 or 2%. Hygiene care is very important. When hygiene care and all is good, then the, infection rates get very low, and that is our aim, right? The other study, I have one or two more slides. So the other thing which I have come across, and it was always there, that it is said that, vitamin D is very important for us. Like many of us, the vitamin D level is very, like we are deficient of vitamin D. So the sufficient level should be 30. And they have seen in few pediatric patients and adults that when they did boluses of this vitamin D to the deficient patients, the respiratory symptoms got, corrected. So this is very important. And today's message would be that everyone should check their vitamin D level and then top up by consulting their physicians. Okay, the summary is chain of infection is a process of which favorable conditions are required, for growth and transfer. The things like aseptic techniques, hand hygiene, proper nutrition, immunization, waste management, sterilization, and proper use of PPE can, keep you away from these infections. And we all need to do the safe practices to break the chain. Safe awareness is a big step, and but negligence can be the last. So we all need to be very much careful with this. Thank you very much.
Thank you very much, Dr. Ms. Roshan. It was a very, you can say, elaborative kind of session. और माशाल्लाह आपने तमाम एस्पेक्ट्स को कवर करने की कोशिश की है. Definitely, time is always limited with us. but the way you have gone through this whole process is phenomenal. Uh, if we may ask Ms. Saba Akbar to also join us for the question and answer session. क्योंकि पहले से काफी सारे questions आए हैं, तो Ms. Saba, if you can turn on your mic as well. मैम, कुछ क्वेश्चंस ये आ रहे हैं कि फॉर एग्जांपल आपने एक बात की थी कि एप्लीकेशंस जो हैं वो हम लोग यूज कर सकते हैं फॉर द इनिशियल डायग्नोसिस ऑफ फॉर द कोविड. इसके बारे में क्वेश्चन ये है कि हाउ मच द ऑथेंटिसिटी ऑफ दीज एप्लीकेशंस आर.
Yeah, good that somebody raised this question. This is an extremely important question. Whatever health app that you use, if it's a symptom checker or anything else generally, it's very important कि हम देखें कि number one, किसने बनाई है? Is it, so for example, for coronavirus, CDC has a symptom checker, which I believe is very authentic because, so look at the developer of it. If it is some independent software developer जिसने ऐप बना दिए, तो I think उसका authenticity से ज़्यादा, if you could find somebody, for example, WHO का symptom checker है या CDC का है, like I said, or even Pakistan में AKU has come up with a symptom checker, so you can trust those because you know कि उसके पीछे evidence गया होगा, उसके पीछे research ने काम करा होगा, clinicians involved होंगे. So number one, look at the people who have made it. So author पे जाएं apps के लिए. Never trust app store की rating. So what you usually do is कि अच्छा app store पे 5 star है, ये app तो मुझे चाहिए. Don't do that because app का star rating is never equivalent to its medical reliability. So I would suggest always look at who has made it.
Okay. And the other application जो आपने ट्रेसिंग एप्लीकेशन के बारे में कुछ बताया था, मिस थोड़ा सा इसके एलैबोरेट चाहिए और इसके अंदर भी थोड़ा ऑथेंटिसिटी वाला ही मामला दोबारा से इसको हाईलाइट कीजिए.
Sure. So जो ट्रेसिंग एप्स है वो ज्यादातर गवर्नमेंट्स की तरफ से कुछ कंट्रीज के अंदर इम्प्लीमेंट की गई है. फॉर एग्जांपल देयर इज दिस वन that's called Trace Health, which is in Singapore. So what these apps do, like I said, कि वो आपका मैप जैसे आप यूज करते हैं जो आपका जीपीएस का डेटा से चलता है, इसी तरह ये ऐप अगर आप अपने फोन में डाउनलोड करेंगे तो दिस विल ऑलवेज मॉनिटर योर मूवमेंट कि आप कहाँ जा रहे हैं. फॉर एग्जाम्पल आप घर से बाहर निकले हुए हैं और फला बिल्डिंग में है या फला रोड पे है या ऑफिस गए हुए हैं, एंड देन आपके पास भी वो ऐप है और उन गवर्नमेंट्स ने क्या करा है, सबको बोला है लाइक हर पर्सन, हर सिटीजन ऑफ दैट पर्टिकुलर कंट्री इज सपोज टू हैव दैट ऐप. अब जब सबके पास ऐप है तो हर किसी का मूवमेंट मॉनिटर हो रहा है, राइट? एंड देन इफ समबडी इज डायग्नोज्ड पॉजिटिव विद कोरोना, what they do is they trace back the movement of that patient and then they say कि अच्छा इस दिन इस वक्त ये patient for example इस building में था, and then इनके इर्द गिर्द कितने मोबाइल नेटवर्क्स नजर आ रहे हैं, किसका फोन नजर आ रहा है, and then if your phone was found to be in that locality, you will be considered as close contact and then you'll get a call from authority के जी आपका जो है वो close contact है and now you have to be in self-isolation for 14 days or whatever the duration is.
Okay,
so yeah,
that's
apps जो mainly surveillance के लिए use हो रही है.
राइट. मिस रोशन, आपसे एक क्वेश्चन है कि जैसा से आपने आईसीयूज की बात की कि वहाँ पे भी टू टेक केयर ऑफ द पेशेंट्स बाय द स्टाफ एंड पैरामेडिक्स. मैम थोड़ा सा ये गाइड कीजिएगा कि हाउ वी कैन इंश्योर द प्रिवेंशन ऑफ अदर डिजीजेस इफ वी पुट the patients on the split ventilators. आजकल जो कि वेंटिलेटर्स की कमी आ गई है तो जाहिर सी बात है उसमें स्प्लिट कर रहे हैं, तो पेशेंट को कैसे हम लोग प्रिवेंट कर सकते हैं?
देखिए एट दिस टाइम ये एविडेंस बेस्ड तो नहीं है, दे आर डूइंग ट्रायल्स, तो आई डोंट थिंक सो एट दिस मोमेंट, एटलीस्ट पाकिस्तान में या इन आवर सेटिंग वी आर नॉट थिंकिंग फॉर दिस. वी गॉट इनफ ventilators but at this time we cannot say, you know, अगर हम ये इस तरह की चीजें यूज करते हैं तो we are transferring the infection from one person to another. You know, yes. आपके ऑर्गेनिजम्स को के हाथ पांव नहीं है या हम कहें कि उनके इतने हाथ पांव हैं कि वो एक एनवायरनमेंट से दूसरे एनवायरनमेंट में, लाइक इफ इट इज कनेक्टेड, तो वो यहाँ से बहुत आराम से मूव हो जाएंगे. तो आई डोंट थिंक सो कि एट दिस टाइम हमें इस तरह की चीज़ें सोचनी चाहिए, बट येस ट्रायल्स आर डन, बहुत सारे लोग ट्रायल कर रहे हैं, लेट्स सी क्या चीज़ आती है, बट आई डोंट थिंक सो कि इस
ओके,
वक्त इतना ये
लकीली इन पाकिस्तान हमें अभी इतना ज्यादा प्रॉब्लम नहीं है कि
जी
हम लोग
जी जी जी
वेंटिलेटर
यस
सस्पेंड करें।
जी
दैट्स
बिल्कुल
वंडरफुल।
बिल्कुल
मिस,
जी
चूंकि स्टाफ नर्सेस भी काम कर रही होती हैं बेड साइड पे, तो
जी
स्प्रेड ऑफ द इन्फेक्शन को रोकने के लिए क्या वी शुड लेबल दी स्टाफ लाइक दीज आर द स्टाफ हु आर कोविड टेकिंग केयर पेशेंट एंड
यस
दे आर द नॉन कोविड, सो
यस
मुझे थोड़ा सा
ये
बताइए क्या
जी
स्टिग्मेटाइज्ड
जी
हो
जी
जाए?
बिल्कुल जी बिल्कुल बिल्कुल हमने बिल्कुल इसी तरह किया हुआ है कि वी हैव मूव्ड लाइक जैसे ही ट्रैड से हमें पॉजिटिव लाइक कॉल्स आती है कि भाई दिस पेशेंट कुड बी सस्पेक्टेड हो सकता है या पॉजिटिव है, एंड देन दे आर रिक्वायरिंग दी वेंटिलेशन या कार्डियक इंटरवेंशंस चाहिए, so we are moving those patients in, we have developed a unit where we are taking all the positive and suspected cases, and then we are taking care of them. Like कुछ स्टाफ को वी हैव ट्रेंड कि भाई क्योंकि हैजमेट किट सबको दी हुई है, तो उनको हमने एजुकेट कर दिया है कि भाई ठीक है, अगर इस तरह के पेशेंट आते हैं तो हाउ मेनी स्टाफ विल टेक केयर ऑफ दोज पेशेंट्स, कितनी देर दे विल बी इन द रूम, लाइक नेचुरली दे नीड टू हैव समथिंग, खाना पीना भी ज़रूरी है, तो for 4 hours or 6, they are staying in the same room, and then they are coming out, and then the other shifts goes in. तो जो पीपी ये पहनते हैं, वी हैव इंस्ट्रक्टेड देम कि जितनी भी पीपी है वो आए, एंड देन इट शुड बी डिस्कार्डेड, एंड देन द पॉइंट ऑफ यूज जहाँ पे वहाँ यूज हुआ है उधर ही वो आफ्टर द पेशेंट केयर उसको डिस्कार्ड करें, एंड दे सबको उनको हमने ट्रेन किया हुआ है। फॉर इंस्टेंस CRR टीम की मशीन्स यूज हो रही, तो माई लाइक आर ICNs, वी गो टू द यूनिट एंड वी चेक कि भाई वो सारे प्रोटोकॉल्स फॉलो कर रहे हैं कि नहीं, because at this moment doctors and nurses they are like they are so busy with the patients, because all the patients they are coming, they are in critical critical उनकी conditions होती है, तो they are very busy, so इनको time by time हम educate करते हैं infection control nurses, and we have got a task force for COVID जो कि बहुत अच्छे से हमारे पास NICVD में वर्क कर रहा है, एंड दे आर स्टेइंग इन द यूनिट एंड दे आर ऑब्जर्विंग कि कहीं पे कोई लूप होल है तो वी कैन एजुकेट, सो दिस इज द वे वी आर टेकिंग केयर ऑफ इट।
राइट। मिस सबा, आपसे एक क्वेश्चन एक हमारे व्यूअर ने किया है कि मैम, आई हैव अ क्वेश्चन, मेजॉरिटी population of Pakistan is the rural area, and these facilities and apps are, well, they are not so much aware with the technology, so how can we make things easy for them in this current scenario?
Yeah, that is totally a very valid point. When I was putting things together, I wanted to put a challenging slide at the end, but then I skipped that one out. And that had this, because we're saying that coronavirus ka jo main at-risk population, and that is our elderly. And then again, elderly is also the group that don't use phones much. They are not tech savvy per se. They don't have access to technology. So of course, that's a challenge. What we can do is make things available in our own regional language. That's something that's still lacking. If you look at apps, I have seen certain apps coming up in Urdu now, but there is not much happening in regional languages. So that's the first thing that can happen, which is if the viewer, if there's someone who is a software or app developer in the viewers, we need to work on making things friendly for regional areas, which includes language friendly, literacy friendly. Now, a lot of apps now use pictures or photos as the mode of communication. So that has been worked on. So a lot of people who can't read can still use certain apps which have, for example, a very common example is pain score. So now instead of doing 1 to 10, people do facial expression. That's another kind of, like you use pictures and graphics to do it. So there has been work under development things, but yeah, there is still much that can be done. This is kind of a limitation of digital health at this point, especially in Pakistan.
Okay, that's thank you very much. Ma'am, I would have this second last question from Miss Miss Roshan. That person has asked that what is the probability of transfer of this virus from a pregnant woman to her newborn?
Yes.
Actually, I've heard that newborns does not possess receptors in their lungs for the virus. So please correct me.
यस बिल्कुल बिल्कुल उन्होंने सही कहा है क्योंकि दीज डेज विमेंस जो है प्रेग्नेंट वुमेन्स वो भी वेरी हाई अलर्ट पर है तो इफ दे आर इफ दे गेट इफ दे गेट दिस काइंड ऑफ इन्फेक्शन लाइक कोविड-19 है एंड इफ पेशेंट डिलीवर होता है बेबी डिलीवर होता है तो द गायनी पीपल they are alerted that the baby and the mother, they are not kept together. ठीक है, the transfer is there. Yes, it can be transferred, but we don't have at this moment, हमारे पास इतना literature है नहीं, we don't know, but at this moment we are saying कि yes, transfer हो सकता है. So, the pediatrician should be there when the mother gets delivered. It should be handed to the pediatrician, and then special care should be taken for the child and for the mother separately.
Okay, thank you very much, Miss. And the last question from Miss Saba, that is, how do we quarantine management at home? उसकी कुछ टिप्स थोड़ी सी हमें जरूर पता चलनी चाहिए बिकॉज जनरली पब्लिक को जो है वो घर में लाइक कैसे अपने आप को आके अपनी उसकी क्या रूटीन होनी चाहिए जब वो बाहर अगर जाते हैं तो वहां से जब घर वापस आते हैं तो देन what should be done?
So if you're in strict self-quarantine, which means if you are COVID positive or if you have been in one of the close contacts, the guideline is to not leave your house. So don't leave your house, stay inside. एक अपना रूम घर के अंदर डेडिकेट कर लें कि दिस इज वेयर यू विल स्टे. इट इज वेरी वेरी हार्ड एंड आई हैव सीन पीपल स्ट्रगलिंग सो मच विद बिकॉज इट्स नॉट इजी. हमारा इतना आदत होती है बाहर निकलना and then घर के अंदर एक कमरे में बंद जाना is very difficult. We all understand, but this is what the need of the time is. So ideally you should stay in your room. Everything that is in your room should be with you for that period of time, so there should be no exchange of material. If you can recall the video that Roshan just showed, जल्दी infection फैल रहा है, right? कुछ भी आप touch करेंगे फैलेगा. So try and be in one room. अपनी चीजें अपने पास, सारे बर्तन आपके अलग होंगे. अगर आपको बाहर से जो भी खाना दे रहा है, so वो होगा कि बाहर खाना छोड़ के जाएगा and आपने वहां से खाना पिक कर लेना है. आपने बिल्कुल हाथ नहीं मिलाना किसी से, घर वालों से भी. इनफैक्ट families, if you care about your family, you gotta do it, right? So stay in your room. Temperature अपना monitor करना है regular intervals, at least twice a day, and if it is more than normal 37 से ऊपर, you have to report it. And then see, it's kind of a flu, so it will take time to go. That's why we say 14 days. इस bracket के अंदर it will go away, but इस दौरान you have to take care of yourself. कुछ symptoms है, high alert symptoms that you have to be careful about. For example, सांस लेने में तकलीफ होना शुरू हो जाती है, बुखार बहुत तेज हो रहा है, चिल होना शुरू हो गए हैं. All of that is an alerting sign, and if that happens, you gotta call emergency. So get an ambulance and get yourself to hospital.
Right. So Ms. Roshan, final words from you to just close the session.
Okay, I think इस वक्त जो सिनेरियो चल रहा है and the precautions which we infection control is giving is not new for us. You won't believe the flyers which I have shared, the movie, the videos we have shared is not this time we are sharing. These are the things we are sharing. Like I was at AKUH, like I joined infection control in 2002. So since that time हम इसके यही चीजें पढ़ा रहे हैं कि भाई किस तरह पीपीई पहनना है, डॉन ऑफ किस तरह करना है, हैंड हाइजीन कब करना है, ग्लव के साथ आप हाथ कर्टन मूव न करें, चीजों को टच न करें, जब आपने पीपीई कोई टास्क कर रहे हैं तब आप अपनी पीपीई पहने. दीज आर दी थिंग्स जो कि हम इतने सालों से यही पढ़ा रहे हैं. And but I don't know, we should say thanks to अल्लाह ताला कि ये जो सिनेरियो आया है इससे लोगों की आंखें खुल गई है, आंखें खुल गई है. तो अल्लाह मियां रहम करे, लेकिन इसने लोगों की आंखें जरूर खोल दी है कि व्हाट इज द इम्पोर्टेंस ऑफ इन्फेक्शन कंट्रोल. और अब तो बच्चे बच्चे को पता है कि हाउ दे शुड वॉश हैंड्स एंड व्हेन शुड दे वेयर मास्क एंड ऑल, पीपीई कब पहनना है, कब निकालना है. एंड इफ समबडी इज कफिंग ऑल्सो तो वो दूर से ही कहते कि प्लीज पीछे रहो. तो वो बहुत सारे अलर्ट आ गए हैं. And inshallah, if we are following the precautions, if we are breaking the chain of infection, environment में organism इस तरह के हैं, बहुत सारे organisms आते रहेंगे, viruses आते रहेंगे, but if we follow the standard precautions, we will break the chain of infection, and then inshallah we all will be safe here.
इंशाल्लाह. सो थैंक यू वेरी मच मिस, आप दोनों का बहुत शुक्रिया, आप लोगों ने हमें ज्वाइन किया, और इट वाज प्लेजर हैविंग यू ऑन द वेबिनार. और आई होप सो कि हमारे जो कॉलीग्स हैं जिन्होंने ज्वाइन किया है उन्होंने काफ़ी ज़्यादा इससे लर्निंग ली होगी. सो थैंक यू वेरी मच, स्टे इन टच, इंशाल्लाह विल बी कनेक्टेड.
Inshallah.
थैंक यू वेरी मच.
Thanks.
Thank you.
Thanks.
Thank
Bye.
you.